Okay, so I can hear myself. I'm going to make sure. Okay, I can hear myself. Okay, there's that. Okay. Yeah.
So when did you start this page?
The podcast?
Yeah,
I started it in October, actually. Can you hear me okay?
I can. Am I cutting out?
No, it's a little bit, I don't know how to describe it. It's a little bit buzzy. I don't know if it's maybe just your the speaker on your phone or on
I'm
your
not
headset.
sure. I'm not sure.
Do you
I
sound
wonder. Well, because I just moved and now I live along Hammond Bay.
Oh, okay.
And I know that Hammond Bay is like a super sketchy area for like signal and stuff. So I don't know. Do you want me to try phoning back?
No, it's really clear. It's just, it could be my headset too, right? It could be,
Okay.
yeah.
Okay.
But
Well, let me know.
yeah, I'm just going to make sure that I'm recording. And yeah, so how are you doing? You
Good.
going
Really good.
a little bit crazy with your,
A little, but you
yeah.
know what? There's always silver linings. Like it's really nice. I got to move. I got to like unpack and
Yeah.
I got to do all that kind of stuff. But like work wise, I am not going back for a long time.
Oh,
Like I think that our college was talking to us, and when dentistry does go back, it's strictly for fillings and restorative treatment. So they're deeming cleanings a non-essential, like for your health basically at this point in time.
oh, okay. Yeah.
So the risk of us going in there, we're the number one job risk, so we're 99.7% likely to spread the virus,
Yeah. Just
especially
because
when we use that water pick too, right? Because it
yeah.
just flies aerosols everywhere. So
Oh, so
so yeah.
what are you gonna, are you guys able to collect employment insurance and
Yeah, so I'm just collecting through Curb right now, so we can do that. And
yeah.
then honestly, I'm just deferring my mortgage
Oh, yeah. Yeah.
and then just making it so then at least we'll have income to live. And I mean, it
Yeah.
sucks to defer, but whatever, you got to do what you got to do to live.
That's right. Yeah. Yeah, I can see
Yeah.
your place looks pretty nice there.
Oh, I just like, honestly, it's so nice. And there's Audrey.
Hi, hi. Now that's the sister of the one that you originally got, right?
Yeah, so
Aw.
she's about 8 now, and
Wow.
she's such a good dog.
Hello, girl. Oh, she can't hear me because you got headphones
Yeah, she
on.
can't, but she's such an easy. I tell her she's the easiest lady in my life. Hey,
Yeah.
Audrey. It is, but the kitchen's so nice too. Like
Oh,
everything's so
yeah.
nice.
Beautiful. And you
Love
got
it.
a nice view? Looks like
Yeah, so we actually have like a peekaboo ocean, so you can kind of see it.
you know the ocean is over that way. Oh, that's great.
Yeah, exactly.
We
It
can see
is.
down
It's
into your neighbor's house. That's always nice.
yeah, and that's the thing too, is our other house was so private. So like
Yeah.
our backyard, you couldn't build in our backyard. So that's the only thing I'm adjusting to, is that no matter where I go out, there's like someone that can see into our house.
Yeah.
However, Frank Ney is literally like across the street there, and my son starts kindergarten next year. So we just wanted to be closer to a school and get the
Frankly.
kids through the elementary school phase, and then we'll
Okay,
regroup
so
after that.
you're on Hammond Bay. Now, what are you looking down on?
That's the church. So if you look down there, like, you know where Harry Whipper is?
Yeah, my parents live on Williamson, which is this,
Oh,
right? Okay, so you know you go through the school zone.
yeah.
You just go past the school up. I think they're the third house on the right side.
Oh, I'm so close to your dad then. Oh, I'm gonna bug him next time I see him. I love
Yeah,
bugging your dad. It's
yeah,
so fun.
yeah, yeah. You're just
Oh,
like
that's good.
you could probably chuck a rock and
Uh,
hit their house. Yeah.
so can you see the church from their house?
No, because the church is on the corner, and so that's the corner of Williamson and Hammond Bay. So you drive down like you're going to go into there's this Harry Whipper's on the left, and then there's
Yeah.
the school is on the left, and then there's
Oh my gosh, do you know what? I think I've seen him out there working one time. He's always mowing his lawn.
well, yeah, usually they're both
Oh,
out there all the
that's
time.
so funny.
Yeah,
Beautiful area though. Oh my
it is.
gosh.
It is a beauty, and you're so lucky to be nice and close to the school.
And that's what we wanted. We were too
Yeah.
far. And honestly, our area was getting filled with crime and like it just
Yeah.
sucked. So I was like, you
Yeah.
know what? I want to grab as most equity that we can out of this
Yeah.
before prices start plummeting. So
Yeah.
we did. We did good.
Good for you. Good for you guys.
Yeah.
Okay, well, I guess we should probably get going because you're probably the clock's probably ticking before they come
Mm,
back. Hey.
honestly, they'll be gone for like a good solid hour. So it's all
Okay.
good.
Okay.
We got
So,
time.
what my plan is to do is I'm going to do a recorded interview over like before we actually start our interview together.
Okay.
So I'm going to do the interview that you talked about,
Okay.
that you wrote me. So I just kind of want to reconfirm with you that you're a registered dental hygienist,
Yeah.
and you've been at the clinic for 10 years.
Yeah.
I've been a patient there for 22 years.
Oh, that is so insane.
Yeah. Yeah.
Oh
I
my
think
gosh.
Dr. Brian was like, he'd been doing it for a little while, but not that long. I got in on kind of like a,
Yeah, he opened it in 95,
yeah, 90s, 98. I think I started going there.
and that was his fourth year practicing at that point.
Yeah. Yeah.
Yeah, so crazy. He used to work for TELUS before he became a dentist. Yeah.
Wow. That's
He
kind of
used
cool.
he used to be a pole climber. And
Wow.
then yeah, and then I'm like, what did you do? Like get shocked by electricity up there and be like, I'm gonna become a dentist.
Yeah. Yeah. Yeah.
But yeah, he always wanted to, so he just did.
Oh, good for him. Yeah. So, and then you received your diploma from the Canadian National Institute of Health,
Yes. Yeah.
and you became a hygienist because you've always loved teeth. And I think
I really I
I'm going to
really
bring that up.
have. I've
Yeah.
always like when anyone talks to me, like I always have to like look at their teeth. I've always liked teeth. I mean,
Yeah.
I clean dogs' teeth on the side.
Yeah. Yeah.
I just always have really thoroughly enjoyed cleaning teeth. And it's not really just about having a nice smile. It's just about like knowing that it's like healthy. It's weird.
Yeah.
It's very weird. I've always just been attracted to it.
Everybody's got their thing, right?
Yeah, I guess so.
And you originally had wanted to be a dentist, but when you noticed what was happening in the office, you saw that the dentist was he was like working
Yeah.
hard, and the hygienist was like having a good time. And
So my parents obviously wanted to influence me. They're like, "Oh, if you're gonna do something, like go be a dentist and da da
yeah.
da da." So they said, you know, go shadow your dentist and like see to make sure that it's something that you want to go into.
Yeah.
And my dentist, like when I was a child, like my childhood dentist was kind of flighty. So like he was very high stress, and most dentists are on the higher stress scale of things. But I just found that they didn't get like the communication with the patient. Like you spend that solid hour with your hygienist where
Yeah.
you get that 5-minute glimpse with the doctor. And like if you even don't phrase your question correctly, they don't even answer the question that you've asked. And then they're in and out in like 5 minutes flat. So I
Yeah.
just found there is like a major disconnect there,
Yeah.
and that he couldn't like sit down and have like some solid time. So when I was following him around running with him basically,
Yeah.
then I just remember looking over and seeing the hygienists work, and they were listening to music and chatting and
Having a good time. Yeah.
laughing, and I was like, yeah, I want to do that.
There you go. Yeah.
And that's how it
And
started.
okay, so I guess what we'll do is, so basically I'm going to have a pre-recorded interview. So we'll start and I'll just
Okay.
kind of edit it out from here. So
Sure.
I'm just going to basically start like we're talking to guests, like talking to
Okay.
viewers. So it's kind of
Okay.
a little weird, but
No worries.
okay. So we're going to go. Okay. I'm recording. Okay. Welcome back to the Parkinson's Road podcast with me, your host, Tanya. And today my guest is Brett Kirby. He's a registered dental hygienist, and he works at my dentist's office, which is Diver Lake Dental Clinic in Nanaimo, British Columbia. And he says he's always loved people's teeth. He loves teeth so much that he doesn't just clean people's teeth, he cleans dogs' teeth as well. So
Yes, I do.
welcome to the show.
Thank you so much for having me, Tanya.
Yeah.
There's no one else that I'd like to help out more than you. So this is a great experience.
Yeah. Have you ever been on a podcast before?
I have actually never been on a podcast. So check that off my bucket list now.
There you
That's
go.
great.
Yeah. Your life is complete. Well, I really appreciate you agreeing to do this. I know that Sasha had originally said she was going to do it, but I think she was a little bit put off by, she didn't know what to expect. So I think she decided to defer to you. So I'm glad I'm glad you could do it.
This is right up my alley, totally. So
It totally is. It
don't
totally
even
is.
worry.
Yeah. So I just wanted to say thanks for coming on. So you don't just clean people's teeth, you clean dog teeth.
Yes, I do. So on the side, after about working as a hygienist for about 6 years,
Yeah.
I started opening, and so now I have Kirby Canines, which is a anesthesia-free dog teeth cleaning. So
Okay.
then animals also get the benefit of having their teeth and getting the tartar removed as well.
Yeah, because it's equally as important for your pets to have clean, healthy teeth.
Mm-hmm.
Yeah.
Oh, totally, 100%.
Okay, so I need you to tell me how to get my dog to floss.
Yeah, right. If you
Yeah.
if you ever figure that out, then you and me need to talk.
Yeah. Get their little paws in there. Yeah.
But I do use electric toothbrush on my dog,
Really?
and it does work. After like a solid week of pushing through it, they will just let you do
Okay, well, I think my dog would chew mine. We'll chew it up, right? I guess you can't share.
it. Yeah, I'd get
No
your
sharing.
own.
Yeah, get your own, yeah. Yeah. Okay, so I'm introducing something new on the Parkinson's Road podcast. I'm trying something new, and I thought you'd be the perfect person to try this with. So it's a way
Sure.
for people to get to know my guests, and it's called Quick Fire Questions.
Okay.
So I'm just going to ask you a series of questions, and you just answer them as quick as you can, and we'll start now. So the
Okay.
first one is talk or text.
I would rather talk.
Ooh. Would you rather speak every language known to humans, or would you rather be able to speak to animals?
Ooh, speak to animals.
Yeah, me too. Me too. What's your favorite holiday?
My favorite holiday is Christmas.
Yeah, yeah,
I'm a Christmas lover.
yeah. Christmas is good. Invisibility or super strength?
Mm. Actually, invisibility.
Yeah, yeah, that
I
would be
think I
good
would
for
do that.
you. Sneak around.
Exactly.
Okay, what's your favorite patio drink? And it doesn't.
Favorite, definitely mojito.
Ooh, I like mojitos too with lots of
Yeah,
ice. Yeah,
yeah,
the little
definitely
mint
a
in there.
mojito. Yes.
Yum. Yeah. And who are easier clients to deal with, canines or humans?
Do you know what's really, really interesting is I get this asked a lot, and I
Yeah.
get bit less by the dogs than I do by humans.
I
They
don't know.
are,
Yeah.
yeah, to be honest, they are just like they are not as, I would say, sensitive as humans, because I think our gums and teeth just have more
Yeah.
nerve endings and whatsoever. But as far as the dog is, once they're outside, they get to run around, and
Yeah.
it's
Yeah.
a very positive experience. However, I can go more in depth when I work on a human, and
Yeah.
then you could seeing the disease reverse and that kind of stuff. That is definitely by far more rewarding on my
Yeah.
end.
What color is your toothbrush?
My color of my toothbrush is actually navy blue.
Ooh, I like that. If you could be a flavor of ice cream, what flavor would you be?
Ooh, chocolate chip mint. I'm a mint fan.
I like chocolate chip mint too. Yeah. I like the little when they have little bits of chocolate chips in there too.
Oh, so good.
Are you a morning person or a night owl?
Oh, 100% morning.
I have managed to transition myself. I still have those little moments where I want to be a night owl, but I've managed to switch myself to being a morning person.
Yeah,
Yeah.
I'm actually in bed usually by like 8:30.
Yeah. Well, you have two young children, so
Yes.
you're probably just exhausted, right?
My honestly, both my kids wake up around like 5:36, so that's usually when I start my day. I know.
Wow.
So by going all day, then by 8 o'clock, I'm just wiped.
Wipe, yeah. Netflix or YouTube?
Netflix.
Yeah. And
Yeah.
the last one, is it wrong for vegetarians to eat animal crackers?
Oh. Do you know what? I don't know. They have a little bit of guilt going on if they do that. I would say no, but I think they would have a little bit of a mind struggle doing
Yeah.
it.
Okay. That's all. That's my rapid fire questions. I just thought that
Good
would be
questions.
yeah.
Good icebreaker.
Yeah. So not like we ever have a problem talking.
Oh, I know, right?
Yeah. So obviously the focus of the Parkinson's Road podcast is talking
Mm-hmm.
about Parkinson's related issues. And I'd given you some topics that we're going to discuss. So we might as well get into the meat and potatoes. This is I have some
Sure.
listeners and people that have asked some questions. So the first sort of topic that people were asking about is with Parkinson's, we
Mm-hmm.
have, issues with movement, right? Where either we're locked up and can't move at all, or some of us have tremors and difficulty with motor control and fine dexterity.
Right.
So do you have any tips or tricks for people who might have issues with holding things on how to be able to take care of their teeth properly?
Yes. So during the 10 years of me practicing doing this so far, there is the one thing that I find very interesting with Parkinson's is that there's a very wide range of symptoms.
Yeah.
And with that being said, some of them, like their main issue actually seems to be more of the tremor, where some of it is like super tight muscles, where I've even seen their hand getting like bent almost
Yeah.
inward.
Yeah.
And so in the past, what I've actually done, because I found the electric really is the best way to go.
Yeah.
But I even have some patients that the vibration
Hmm.
actually it affects them for the rest of the day. So when the vibrations in their hand, they notice that after that their hand just feels off for the
Oh,
rest of the day. And I did try to do some research on like high intensity vibration, because with an electric toothbrush, it's not just a standard vibration. The pulse is like literally can like shake dirt off a dirty sock. Like it's
yeah.
really, really, it's like an ultrasonic almost.
Yeah.
So with that, if they struggle with the vibration, because I've had some patients with Parkinson's say that their hand feels numb after they use from the vibration from the toothbrush.
Yeah.
So it limits them from how long that they can actually use it.
Okay.
So we have this machine in the dental office that we use to make mouth guards, and it's a real hot element and it melts the plastic.
Hmm.
So what I've actually done with them is I've looked at their hands, and then I melt the toothbrush pole part, and then I
Oh,
actually take the toothbrush and then I'll bend it.
like this part?
Yes, yes.
Okay.
And then I'll actually bend it so it's not so straight and uniform.
So
I
it's
haven't done it with an electric, but I've done it with just a regular manual one. And
okay.
it does seem to have helped them, so they can at least get their hand holding the brush and
Yeah.
still getting in there.
Yeah.
However, though, I say if you can, the electric still is the ultimate way to go. So even if you experience a little bit of numbness for 20 minutes after you brush, and then the tingling starts and it kind of get the sensation back,
Yeah.
I still advise to use that, because studies have shown using an electric toothbrush for 2 minutes, for you to get that same effectiveness, meaning gum stimulation, plaque removal, bacterial removal, you'll have to use a regular handheld one for almost 16 minutes.
Well, yeah, I mean, yeah, I know, I definitely notice a difference. I use an electric toothbrush all the time, except when it's charging, and
Totally.
it's just it makes a huge difference. You can just feel it feels like you almost like you've just been at the
Yeah,
office getting a cleaning, right?
totally.
Every time.
Totally.
Yeah, I
And
know.
so even yeah, right. Even if people feel like they're only brushing their teeth for 30 seconds with an electric,
Mhm.
in my eyes, you're still doing way more in a shorter amount of time than
Yeah.
you ever can with the manual.
Okay.
However, if the vibration is too much, then I will fabricate them something that will just help them ease into it a little
Yeah.
bit better.
Okay, so what about for things like flossing and water picking? Water picks may not be the best choice for people with Parkinson's. We got to make
Well,
sure you get it in your mouth first.
and that's the thing too, is
Yeah.
like even like a water pick it has a little bit of a learning curve.
Yeah.
So if someone has Parkinson's,
Mhm.
but at the same time they are also battling gum disease,
Yeah.
a water pick would be super beneficial, because it's going to get into that pocket, flush the pocket out,
Yeah.
and then you're going to maintain a healthier gum system.
Yeah.
But I find that honestly, like the person even without Parkinson's, they struggle flossing with regular floss. Like it really is a learned skill.
Yeah.
So I just say if you can still hold like a floss pick
Yeah. I have
and you
one.
can still get in there, that's the best way. And it's even better than the water pick itself.
So this is a little
Yeah.
floss pick. Yeah. And this one has a little flip down piece on the
Yes.
end that you can
Which
kind
is
of,
perfect.
yeah. I
Yeah,
hopefully you
so that those will work really well, and
yeah.
especially like if there's no gum disease and you just need like normal maintenance, like just normal food gets stuck between your teeth,
Yeah.
that's actually the better route to go. You
Okay.
can actually damage yourself too with a water pick if you're not adapting it correctly.
Right.
So I always find if like as my practice routine, if I recommend a water pick and
Mhm.
they buy one, I always ask them to bring it in on my lunch break or whatever, and then I'll show them how to use it.
Yeah.
Because if you use it correctly, it's actually a really good tool to use.
Right. Yeah. Yeah, I don't use the water pick, but my husband was using one, but he was not really being diligent about making sure to clean the
The
water line.
lines.
And I think he gave himself a little bit of an infection because he basically shot unclean water down into his gum line.
Right.
So yeah,
And so what I suggest too, for anyone with Parkinson's or anyone for this matter that
yeah,
is using a water pick, put like a cap full of Listerine into
yeah,
the water.
yeah.
And then that way, as the water runs through the lines, it's antibacterial rinse thing too. That will just kill everything that's in there.
Keep it nice and clean. That's perfect.
Mm-hmm.
So flossing is still important. Now, what about those? I don't have one, but those ones that are like it's the handle and you can wrap traditional floss.
Yeah, so we call them dental forks. So there's
Yeah,
basically like two prongs at the
yeah.
end, and then you can. But the thing is, too, you need some fairly good dexterity to wrap the floss up and around.
Yeah, that's true. These are preloaded, so there's a piece of floss. I hope
Exactly.
ready to go
It
there.
is. And
Yeah,
so, but the only advantage of those the forks are that they're a little bit larger. So
yeah,
you can have more of like a hand grip on
yeah,
it to get in there. But it's the challenge is loading it.
yeah, yeah.
Mm-hmm.
Yeah, I definitely agree. Well, that's really good advice. I never thought about that about the electric toothbrush. Now I have a Philips Sonicare. Not that I'm like pumping different brand names or anything like that, but
It's the best.
it's the best. So this
Mm-hmm.
is a one. The head goes back and forth. What about the ones that are kind of a rotary type?
So that's by by
Yeah.
Oral-B,
Oh,
and so each toothbrush does do their own studies.
okay.
I have used the Oral-B one for 5 years, and I've now used that Sonicare for over 10.
Yeah.
I by far feel after I clean my teeth with Sonicare that
Mhm.
it does an above and beyond job.
Okay. Yeah.
I find that, it's a much more refined vibration, where with
Yeah.
the Oral-B, it's almost feeling like you're starting up a chainsaw. Like it's
Yeah.
much more like in there, and I
Yeah.
feel it's much more aggressive because it is spinning in that motion.
So this is a Sonic. So they're really, I mean, we're in Canada, so there really seems to only kind of be two major brands of
Mm-hmm.
manufacturers, right? There's Oral-B or Sonicare. So,
Yes.
but basically, what you're looking for is the head to go up and down, like when you're brushing your teeth. That's this how
Yeah.
this one moves, and there's a little bit of an ultrasonic. I think it emits an ultrasonic tone or
So it is a
something.
pulse vibrational frequency. So it's
Okay. Yeah.
not quite ultrasonic,
Okay.
but it is like it's a trademarked, basically vibrational frequency
Yeah.
that will cause the bristles to actually move in an up and down motion, where
Yeah.
Oral-B is an oscillating motion.
Yeah.
So I always find the up and down is the better way to go, because when you're scrubbing at an angle, that's gonna cause recession, like receding gum
Yeah.
lines and all that kind of stuff.
You're kind of coming up again. Yeah. Yeah. And
Yeah.
that's an issue as well for people. Well, just as an
Hmm.
age, correct? No, I mean, Parkinson's or not.
Well, to be honest, there's lots more studies now out there, because people that find with Parkinson's that you actually clench or grind your teeth. And
Yeah.
that is a number one factor for recession. Lots of
Oh,
people don't think when you clench your teeth that it does any damage except to the teeth themselves,
yeah.
but you're putting stress on the ligaments that hold and bind the tooth into the socket. And
Okay.
if you are constantly stressing that and
Hmm.
torquing against the ligaments, the gums will want to droop down, and then that will cause recession.
So they need to make like a gum bra to hold you.
They do, or something. That could be
Yeah.
your claim to fame.
I invented the tooth bra.
Hey, there's crazier out there. I'm sure
Yeah.
you're onto something.
Yeah. So that was going to be sort of the next thing I wanted to bring up is basically that because of tremors and like you say, clenching jaws, rigidity in the face and in the neck, or
Hmm.
dystonia, which is when you talk about the clenched curled up type
Hmm.
muscles, that's dystonia. So it can cause cracked teeth, tooth wear, and changes in the fit and the wear of dentures and other types of appliances.
100%.
So what are some ways that people can, I mean, other than taking their medication for Parkinson's and trying to control the symptoms,
Yeah.
what are some things that a dentist or hygienist can do to help their clients that may have this issue?
So people that do have pronounced dystonia, I definitely use a bite block while I am cleaning their teeth. So something
Okay.
that helps keep their mouth propped open,
Yeah.
but even if they're biting, it's
Mm.
biting against a squishy rubber thing, so it's not going to cause damage.
Okay.
And that I actually find when I use that, it eases their anxiety, because then when they do come in, they feel that they are more anxious and whatnot, because they're worried about how this appointment's going to go. How tired are they going to be after? Like,
Yeah.
is this going to be more of a hassle rather than something that's beneficial?
Yeah.
So definitely the bite block, and then also making sure they get a prescription by the dentist to get that night guard made.
Yes.
One thing that I find super important that is that they should not go out to the drugstore and just buy the one that's $20 off the shelf.
Yeah.
It's really important to get a form fitting one, because if something is form fitting, it's more likely to trick your brain into not clenching.
Okay.
Because if you get something in your mouth, like a normal mouth guard, like if you're a boxer or something, people put that in and they want to clench and bite and squish it between their teeth.
Yeah.
Where this one actually makes a brain response for you to actually relax what you're doing. And then in turn, it allows your muscles to relax and then not get overtired, over fatigued, and all that kind of thing.
Yeah. I wear a mouth guard at the gym. It's just a real thin little one, just because I do you kind of clench your teeth when
You do.
right.
Totally.
So, but I do find that when I'm walking around between sets and stuff like that, I'm like, sticking it out of my mouth. And, you get some funny looks and people are like, what? And then I'm like, oh, put it back in my mouth. But it does trigger like a sort of like, oh, there's something in my mouth. I want to fiddle with it. Right.
Yeah. 100%.
Yeah.
And that is normal.
Yeah. So, so people could, if you notice, if you're having issues with recession of your gums, which can be triggered by clenching, or the, basically that dystonia.
Yeah.
What about and it will help with grinding as well. Like if people have that cross action kind of motion,
yeah,
totally. That. And what about things for dealing with dentures and stuff? Is there anything they can do about that?
So yeah, with dentures, what our number one complaint from patients that have or have Parkinson's that also have dentures is that they get denture sores, because now you're having the acrylic material against your nice soft gums, and if you are constantly applying pressure in certain areas, you will get ulcers on your gums. So I actually say people with Parkinson's, and even though it is kind of a, what's the word I'm looking for? Like a self-conscious thing if they don't have their dentures in. When you are home and you are alone and you are comfortable, take them out. Take them out, let your gums breathe, and that will facilitate, because lots of people think if they don't wear them, even if it's for an hour, then they're not going to fit again. That's not going to happen.
Yeah.
If you have them out for a couple hours during the day, it's going to allow your tissues to get some oxygen, and then also stay healthy, basically.
Good. That's really good advice.
As far as grinding, though, I've seen lots of Parkinson's people grind their dentures, and then they just have a faster rate of wearing through them.
So they basically just have to replace them.
Yeah. And I've actually found with Parkinson's too, based on like how clenching and bruxism, and bruxism is just a fancy word for the act of grinding.
Yeah.
But when you actually do brux, I find with Parkinson's, it's more unilateral bruxing. So instead of it being like a completely flat plane all around the whole mouth, I find that you guys find like one side of your mouth and you just sit there and grind the same spot.
It's probably because they have a tremor in their jaw. Some people do develop a tremor. And so it's like it moves your jaw laterally.
Yeah. And so it's more on like a lateral basis rather than everything being completely flattened.
Yeah, like a true jaw clench.
Yeah, exactly. So it's more on like one side.
Yeah, well, that's really good. I really didn't know that about the clenching causing the recession. And I that's really good information. So it's not really the disease of Parkinson's itself. I mean, it is, I guess, a side effect of the disease, but it's what you're doing and what, the clenching that's causing the problem. And so that would also cause cracked teeth as well, right?
Yes.
With pressure.
Yeah. It can. So with the pressure, and it all depends because everyone's enamel makeup is very widespread. So someone like, however it happens in utero and while your teeth are developing, it is one of those things where some people are genetically blessed where you can throw anything at those teeth and they're not going to crack or get any cavities or whatnot. But people with Parkinson's will be more likely to get those kinds of things because of the symptoms of the disease, not their teeth are bad themselves.
Yeah. Yeah. No, I get that. So a lot of the there are, people in my support groups and stuff that say my teeth are suddenly crumbling because I have Parkinson's, or they blame the medication. And
Mm-hmm.
that kind of brings me into the next topic, talking about things like dry mouth is a
Mm-hmm.
massive issue for people with Parkinson's, because there are so many different medications that cause dry mouth, but also because of sort of the age group that it seems to affect. There's also people who have like burning mouth, myself being one of them, or
Yeah.
that metallic taste in their mouth. But it seems to be that dry mouth is a big issue. And that is also a major contributor to things like cracking teeth, because you
Yes.
need to have, your teeth need to be kept wet all the time. I mean, that's the environment that they're designed to be in,
Totally.
correct? Yeah.
Teeth are very porous, right?
Yeah.
So the way that enamel is made up is it's calcium and phosphate minerals. So people always say like, oh, if I don't have enough calcium in my diet, my teeth are just going to dwindle away and this is how it happens.
Yeah.
No. If you didn't have calcium while your teeth were forming,
Yeah.
then yes, you probably would have had like fluorosis or some enamel pitting or something where your hygienist would have and dentist would have picked it up at a younger age.
Right.
But that stems from like early childhood, not when you get Parkinson's when you're
Right.
in your late 30s or early 30s or whatnot, if that's when it peaks. But I find that if you have the dry mouth,
Mhm.
that's what will facilitate disease process,
Yeah.
cavities,
Yeah.
and then also like mouth ulcers and all that stuff that go along with it.
Yeah. So, it can be caused, I think dry mouth can be caused by a number of different things, and dry mouth, burning mouth, all those kinds of
Mm-hmm.
issues. I think, is dry mouth a symptom or a side? It's medication.
Yeah, so dry mouth is a huge widespread dental,
Yeah.
like there's still so many studies on xerostomia, which means dry mouth, and just how it affects the actual oral cavity.
Yeah.
Medications seem to be the number one reason of not having enough saliva.
Yeah. Got to drink some water.
Oh, right. And so what I always suggest is, trying to find things that are sugar-free mints that will kind of produce saliva flow or something like that that will kind of stimulate it.
Yeah.
There is biotin that is out there.
Biotin.
Yes. Yes.
And I know that this is available in Canada, the United States, the UK, and Australia. I don't know about the rest of the world because I did look that up before. So Biotin makes a ring, and I'm not sponsored. I'm not trying to like
Right.
press.
But to be honest with you though, Tanya, out of
Yeah.
all dry mouth aids,
Yeah.
this one seems to be the gold standard.
Yeah.
Definitely.
And so they make a rinse, which is what this is. They make a toothpaste. They make a gel and a spray that I could find. And then there's also, you were talking about like chewing sugar-free gums,
Mm-hmm.
as well as there's a product called Xylee Melts, which I think,
Shoppers Drug Mart does those.
yeah, and they're a little lozenge that has actually like a food grade adhesive that you can stick onto your gum, and it sticks in there and it just slowly melts, and it releases it's a slow release product, so it keeps your mouth kind of moisturized.
And I actually get patients to use those at nighttime too, if they're
Yes.
chronically dry, because
Yeah.
you don't have to worry about your choking on it or
Yeah.
anything like that. And that's been some good aid. The
Yeah.
one thing with biotin is that it doesn't have the greatest flavor.
I don't mind it. I guess I'm used to it, right? I've been using it
But
for
that's
a
what
long time.
I was going to say. Just persevere through it. And then once you get used to it, just like anything, it becomes your new normal.
And I learned this yesterday, that the different, like water is hydrating, but the difference between drinking a sip of water and using something like a product like a Biotin or something is that these have a humectant in them.
Yes.
And humectants add moisture to the underlying tissues. And that's important because that's the kind of moisturizing that will stay in your mouth for a period of time. You have a sip of water, once you're done, that it kind of rinses everything away, and then that's it. This
Mm-hmm.
has some lasting effects. So that's another reason to use products like this. And I will put the links in the description of this podcast.
Yes. And just to mention why I mentioned too, like when you want something sugar-free,
Yeah.
when you want to produce it,
Yeah.
it's not because I don't like sugar. You need it in your body too. So I'm not saying like, oh,
Yeah.
don't eat sugar because it's not nutritionally best for you, blah, blah, blah. It's because when you already have a dry mouth and then you add sugar into your mouth with the dry mouth, that will drop the pH in your mouth, becoming more acidic.
Yeah.
And so even if you have the worst bacteria in your mouth, if your pH of your mouth is above 5.5, they will, it's a lot harder for them to do their damage. But if
Right.
you drop the pH, which that's what sugar naturally does,
Yeah.
that's what softens your enamel, and that's what allows the bacteria to chew through the enamel.
Wow.
So
Yeah.
it's not actually the sugar causing the cavities, which a lot of people think. It's the pH of your mouth. So if you have something that is more on the acidic side,
Mhm.
so like stay away from lemon water, all that kind of stuff, because you guys are definitely more susceptible for getting cavities. And
Yeah.
especially if you lower that pH in your mouth,
Yeah.
you're just creating a perfect storm.
Yeah, that's really good information. I don't typically drink lemon water, and because I have that kind of burning mouth, and there is a little
Yes.
element of dryness, I don't like that feeling of things
Mm-mm.
like vinegar and stuff like that. So it kind of irritates it. So, but I know a lot of people drink like lemon water because they think it's good for them, right? So that's
And
really
that's the thing. So if people have lemon water, I say I want you to like chase it. Like you down that glass in like less than 5 minutes and just not sipping it throughout the day, because then that's when it will actually cause the damage.
What about sipping it through a straw?
There's some things about that, but the fumes and like just the off, I don't want to say off gases because that's not correct, but like just the actual acidity of it will
Yeah,
still be in your
yeah,
mouth.
that's true. Yeah. So, we talked about the biotine and things like that. Are there any prescriptions? Like, I don't know if the I know that probably the hygienist wouldn't be prescribing it, but are there any prescription medications that people can take if they have a really severe dry mouth?
Yes, pilocarpine.
Okay.
So pilocarpine, I believe, and it is used for people that have chronic migraines as well,
Okay.
but it does increase your salivary flow.
Okay.
Yeah,
Now, the other thing with people with Parkinson's can have is decreased saliva clearing, so they don't swallow as much.
yeah.
And I was reading that, I mean, obviously that can make some people drool. Can,
Hmm.
can having too much saliva in your mouth, like sitting in your mouth, can that cause problems or?
Yeah, so there's always a fine line with something good and bad.
Yeah.
So if there's not enough, it's not good, and if there's too much, it's not as detrimental as having xerostomia per se,
Yeah.
but it can cause like excess salivary flow is kind of associated with more tartar buildup,
Oh,
because then
okay.
you also have more minerals in your saliva. So if that sits along the base of your teeth, when you eat, it's going to cause that calcification quicker. So you can get a little bit more buildup.
Okay.
But definitely out of the two extremes that I've seen, it's definitely xerostomia is by
Yeah.
far the worst. It's
Yeah.
painful. It changes the taste of your food.
Yeah.
They are thinking that it is linked to burning mouth syndrome now, because your mouth is just like responding that something is just not what its normal used to be.
Yeah.
And so even with the burning mouth syndrome, they've even tried doing like linking it to nutritional deficiencies, because now also you guys can't absorb certain vitamins as efficiently as someone that doesn't have Parkinson's as well.
Yeah. We tend to be
And
deficient in like B vitamins and D vitamins, which I try to take, but it's neuropathy is also a symptom of Parkinson's. And I
yeah,
wonder if this is like just a uh, like a neuropathy, a type of nerve pain.
exactly. And
Yeah.
that's the thing, is like you do have 12 cranial nerves that actually come out through the back of your head here.
Yeah.
So, with Parkinson's being it's a neurological disease,
Yeah.
it's definitely, there is some association there. However, there's been some clinical trials that have been done where like high doses of like a vitamin B100 complex, paired with taking some zinc,
Okay.
that can actually really not eliminate the condition itself, but relieve it so it's not as extreme.
Yeah.
Like I've had some people with burning mouth, and the metallic seems to kind of go side and side, where some people
Yeah.
come in and they're like, I feel like I'm sucking on a loonie. Like I feel
Yeah.
like there's a ball of tinfoil in my mouth. Like it's so weird, and I'm not enjoying food. And so then we'll put them on this thing, and then they said that the metal will go away, but the burning still kind of comes and goes in
Yeah.
waves.
It's also can be related to menopause,
Yeah,
and
which
it
is
can
also very true.
yeah, and it can so it can be it can be resultant from Parkinson's itself. the medications. It can be a side effect of being deficient in vitamins, menopause. So I've spoken to my doctor about it, and he's like, good luck trying to figure that out.
And you know what though? That's a very the same thing. Like if you came in and asked our dentist,
Yeah.
like, what do I do for this?
Yeah.
We always wish we could say, oh, you're just missing this and take this and you're going to feel better. But it's one of those things that's like a multifactorial
Yeah.
thing that everyone could be different, but that's how you're showing the symptoms and
Yeah.
signs.
Yeah. It's not my favorite thing in the world, but I know that there are other people dealing with much more severe problems. So, and it does seem to kind of come and go. It waxes and wanes. Like it follows some sort of cycle, but I don't know what cycle it's on.
Yeah. Right. And that's the thing is like
Yeah.
people find that there's times where it is worse than others,
Yeah.
but they can't figure out like, oh, what did I eat yesterday that's maybe setting this off, or like something like that. And I really don't think it's related to it. I think that it's just the body process.
The chewing the gum thing, I mean, I hate having to chew gum all the time because it seems to be worse in the evenings, but chewing the gum helps. And it helps with dry mouth too. I'm constantly sipping water, but chewing gum totally helps. And basically
and that's if that works for you, then I would do it for sure.
So some other things that, when we're talking about dry mouth, I quickly looked up some things about what you shouldn't do. And so, I mean, you should chew sugar-free gum, but limit your caffeine intake.
Yes.
Don't use mouthwashes that contain alcohol.
Because I would not. Yeah. I would stay away from the alcohol.
Is Listerine, some of them, I think you can get one that's alcohol free, but typically if you want to use a mouthwash, use the Biotene, because I believe it's not just hydrating, it's a good oral hygiene product, right?
I would. Like if you are going to go with something, I would just stick with the Biotene and stick with it, because there's also active enzymes in the Biotene which cause like repeated exposure with your mouth to that will actually help it produce its own saliva more on its own.
Oh, that's good to know. Yeah.
That's why I really like Biotene. They're the ones that have been out there the longest.
Yeah. And then smoking or chewing tobacco is also you should probably stop that.
Yeah.
And then apparently over-the-counter antihistamines and decongestants, because they dry your tissue, your nasal tissues out, which are similar to your oral tissues, correct? I mean, they're all kind of interconnected, right?
Yeah.
And then the list I was looking at is they encourage people to try to breathe through their nose, which is, I know that some people are mouth breathers. So
yes. So, and that's a very valid point, actually. Yeah. Even if you notice that if you are mouth breathing at night, definitely people with Parkinson's get checked for sleep apnea, because that can be a very common thing that can just kind of spark.
Yeah.
Because if you are breathing more oxygen through your mouth itself, you're also in turn introducing more bacteria.
Yeah.
So the more bacteria that's just going in and out of there, that's just going to be another risk factor for periodontal disease and just a whole gingivitis, like the whole slew of works.
Yeah. And so, I mean, you can add some moisture to the bedroom at night if it's a problem, but I mean, maybe that's not a good idea because you'd have even more bacteria floating around in that.
Well, and that's the thing is like they say like mouth breathing itself, and this is dating me, but back when I was in school, I remember that they said, if you noticed a patient doing that, you shouldn't be like, okay, well, try not to breathe through your mouth. Well, they obviously know that, but somehow, or their body is making them breathe through their mouth. Mm-hmm. So you should kind of go get your nose checked out, make sure that there's no polyps or anything in there that's obstructing your actual nasal cavity.
Yeah.
And then kind of work your way through. And there's actually some studies out there too, where there's this special tape, and it sounds bad, but you just put a piece of tape over your mouth. Some spouses might like it.
I think that's probably a good idea. You could probably just use duct tape.
Yeah, right?
Here, honey,
and then that way your mouth will be shut, and then your body can train itself.
Yeah.
However, it's always best to go through a medical professional and just make sure that that's okay.
Yeah. I like that idea. Okay, so we did have a couple of questions from listeners, and these are some interesting questions that people had. So someone asked about which toothpaste is the best, and they didn't specify if it was for Parkinson's or not.
Okay. So toothpaste wise, I find if there's two ways that I kind of go with toothpaste. Mm-hmm. If you just need an all over good toothpaste, usually people with Parkinson's, there's some level of sensitivity because you guys are grinding or whatnot.
Yeah.
And so I say, if that is your number one symptom, then use Colgate Pro Relief. It's an amazing toothpaste. In my eyes, it works better than Sensodyne. You
Oh,
get
really?
way, way more effectiveness and a quicker relief.
Wow.
Whereas Sensodyne, you have to habitually use for like over a month for it to really start to kick in.
Okay.
That's just what I find.
So Colgate. Okay.
And then because of the dry mouths as being a huge aspect as well, we really do have to worry about cavities, because
Yeah.
a lot of the food is acidic these days. So your mouth pH is going to drop regardless if it's sugar or whatnot.
Mhm.
And so that I actually recommend a toothpaste called Prevident 5000.
Prevident 5000. And where?
So Prevident is sold pretty much in any drugstore.
Okay.
But if you're from Canada, you can get the Shoppers Drug Mart brand, and it's
Okay.
called ClinPro 5000.
Clean Pro 5000. Okay. I will try to find a link for that and post it in the description.
Yeah, and
Yeah,
so
that's really good.
what makes it different is that it's a super high fluoride ion.
Okay.
That is a bacteriostatic for bacteria, meaning it's like holding two magnets together that aren't supposed to meet, so it kind of resists the bacteria from kind of settling in around your gums,
Okay,
which will
perfect.
definitely help.
Okay, so then their next question was, what about oil pulling?
Yeah, and you know what? Oil pulling within the last decade has been super popular. It started off, not to stereotype it, but a lot of people doing yoga, more on like the
Alternative
natural
health.
life.
Yeah.
Exactly. They were more wondering like what that was doing. And then of course that made a study out of it.
Mhm.
And they have found using the best results is using sesame oil.
Oh, sesame oil.
And what it actually does is if you learn to actually push it and draw it through your teeth,
Yeah.
because of the oil, it traps the bacteria within the oil. So then when you spit it out, you're essentially spitting out bacteria, like it's trapped within that oil.
Yeah.
I've done it. I've done a trial trying to do it for like a month. It is
Mhm.
the biggest cheek workout of your life. Like swishing around for 20 minutes
20
is
minutes.
that's how they say to get the most effectiveness. I could never go that long. I could manage to do 10, and then my cheeks felt like I blew up like 5,000 balloons. Like it was just so crazy. But
Oh,
it does.
okay.
Your mouth after
Yeah.
feels so clean.
Really?
It feels like the oil just makes it so slippery, and it just like you really honestly like you feel like, yeah, like that did something good in there for sure.
Wow, that's really interesting to know. Do you think that that would be, because I mean, oil is moisturizing. Would that be an effective tool?
Totally.
Yeah. Okay, that's good to know. So
Yeah.
sesame
And
oil and at minimum 10 minutes.
yes. And so I would say the sesame oil is definitely the best. It does have kind of a weird taste to it,
Yeah.
not going to lie.
Yeah.
So if people are very taste adverse to it, then you can switch to the coconut oil.
Yeah.
Much easier.
Yeah.
And it's less viscous, so less thick and stuff. But
Yeah.
I found that it was actually harder to swish around with
Yeah.
because it got more liquidy. So then it
Yeah.
was like squirting out of my mouth and all that. But the sesame oil definitely did it.
Okay, that's good to know. Okay, so is there a connection between root canals and mercury fillings and Parkinson's that you have heard or are aware of?
Yeah, so actually that's interesting. About 6 years ago, there was a study out about root canals because people were thinking, we're keeping this dead body part in our body. Like, how
Yeah.
good can this actually be?
Yeah.
So it's kind of like a bone. So
Right.
if you think of a tooth, they drill through the tooth, they take out the nerve. So, and when they fill it, they use something called a gutta percha, which is like a plastic kind of lining.
Okay.
They used to use metal back in the day, silver point metal, but things have advanced and the gutta percha is a lot more effective and faster to do. But there was a study saying that it would lead to cancers, autoimmune diseases, and everything like that. But the study ended up being concluded void because there wasn't enough demographic factors in place. And by that, I mean, you can talk to anyone and be like, oh, okay, this lady smoked a cigarette in her life and she had breast cancer. And
Yeah.
that's kind of how they were relating it. So there
Yeah.
wasn't actually anything scientific really to back it up.
Yeah. Okay.
If, to my knowledge, though, there has been no relations of root canal therapy in relations to Parkinson's at all. Not that I've read.
Yeah.
With the mercury, mercury, it's poison. Like
Yeah.
straight up, it's in your body. It is a poison metal. However, you always have to weigh the risk, pros and cons. So I always find, if someone's not a bruxer, meaning they're not clenching, they're not grinding their teeth, you're not actually ingesting mercury.
Okay.
But if you are grinding,
Yeah.
and I look in your mouth and that shiny silver, like the filling is like super shiny, I know that you're rubbing your teeth together, and that I know inherently you are probably ingesting some of that.
Okay.
And with mercury, there's been no proven study. However, mercury is a neurotoxin.
Yeah.
So it definitely does play a role with your nerves in general. And actually the same with fluoride. Fluoride's a very similar compound where, you know what, if you took a shot glass of fluoride, you would probably die.
Yeah.
But little trace amounts actually have huge benefits. So I just find, like, if you have every single tooth in your mouth, which is 32 teeth, and they all have silver fillings, I would seriously, as they start failing, I would start replacing them with the white fillings.
Right.
But in terms of being like, oh my gosh, I have all this mercury, is this why I've developed Parkinson's? Absolutely not. I don't think it warrants anyone to go get all their fillings removed just because that is a contributing factor, possibly. If it was really clear, anyone that had it would be developing this disease.
Yeah. Well, I don't know if you would develop Parkinson's or if you would develop a Parkinsonism. And I don't know much about mercury exposure, but is it once you've been exposed and you develop symptoms, that's it, it's done, or would you recover? Okay. Yeah.
Yeah.
Yeah. That's really good to know. So, it basically, if you don't disturb the filling by grinding, then you're safe.
I feel very
Yeah.
much so. Yeah.
Okay. So in your opinion, it's not worth replacing if you have a whole mouthful. Is it worth replacing if you have one or two?
Do you know, and that's the thing too, is every time you touch a tooth, there's always a risk of something going sideways. So if your tooth is healthy, the filling looks healthy, I would actually hold off. I would wait until there's a little bit of an open margin where we can get our Explorer in there and be like, you know what, this filling probably doesn't have a lot of life left, then I would switch it out.
Okay. Well, that's really good information. Is there anything else that I didn't ask about that you think that, people with Parkinson's should be aware of?
No, I think that was like very well rounded, actually. Pretty
Good,
much covered a lot of bases.
Yeah. I can see your family's back from the beach.
Oh, hey, vibes.
Hi.
I'm on a video call. I'm talking about teeth. Yeah.
Imagine that.
Do you like teeth? Yeah.
Yeah, just like your dad. Yeah. What's your son's name?
My son's name is Van.
Van, that's right.
Hey,
hi.
Van.
You can't hear me, but I'm saying hi.
And this is Tenley.
Hi. Thanks for letting
She's the shy one.
Yeah.
Yeah, no worries.
Okay, well, yeah, I just that's great information. I really appreciate you taking the time to talk to me today.
No worries.
So you're at Diver Lake Dental Clinic in Nanaimo, BC, and I just want to say thank you so much for being on the show. And I'll put all the links
anytime.
For anything that we talked about in the description of this podcast. So it was great.
And if anyone does have any other questions too, you can always send me an email again, and we can always go over it. It's all good.
Sure. Okay,
more
that's
questions,
great.
The better.
Thanks for coming on the show.
Okay, thank you so much.
Okay, take care.
Stay safe.
You too.
Okay, bye.
Bye.
Good.